So good morning, everybody. Welcome to the last in service today, May 27th, 2022. And I'm going to turn it over to Alka, and she is going to be presenting on the spleen. So Alka, it is all you.
Good morning, everyone. Like Dr. Baldwin said, my name is Alka Johnson, and today we will be exploring the spleen. So by the end of the presentation, the audience will be able to explain the role of the spleen in the human body, as well as determine if the spleen is a necessary organ for us to function properly on a day-to-day basis. To begin, I'd like to describe what the spleen is because it's often overlooked. So the spleen is referred to as the neglected organ because people often see that there's no use for it and stuff like that. It is a fist-sized organ located in the upper left side of the abdomen near the stomach and behind the left ribs. So on the picture to the right, you'll see that's right below the stomach, that little highlighted portion, and it's composed of collagen, reticular fibers, and smooth muscle cells. It also plays a role in the immune system. That's its main function, and it specifically belongs to the lymphatic system. This will be more important later on, but the splenic parenchyma / the splenic pulp is the site of drug metabolism within the spleen. And this section is divided into two sections as well, the red pulp and the white pulp. And this will be more important later on once I describe drug metabolism within the spleen. Next, I'd like to describe the functions of the spleen and why it's important for us. So the spleen fights invading germs in the blood. It controls the level of blood cells within the body. It filters and removes any old or damaged red blood cells. And it also makes antibodies and white blood cells that help the body fight infection. So basically the spleen is it filters toxins out of the blood, so similar to the liver, and make sure everything in the body is okay. The next part of the spleen I'd like to talk about is a splenectomy. This is a common procedure a lot of people get. This is basically the surgical removal of the spleen. There's a lot of reasons why you could get a splenectomy. One of the reasons is if you have a ruptured spleen, especially caused by abdominal injury or any form of trauma. Another reason is if you have a splenomegaly. This is basically the enlargement of the spleen. When your spleen becomes way too big, it often needs to be removed. Sickle cell anemia, certain cancers such as leukemia, infection, and then as well as non-cancerous cysts or tumors also can lead to the spleen having to be removed from the body. A splenectomy is performed using a small video camera and surgical tools, and it's also referred to as a laparoscopic splenectomy as well. It usually takes 2 weeks to recover from this type of procedure. However, you can leave the hospital as soon as the procedure is over with. And after an individual completes their splenectomy, usually antibiotics are given to reduce the risk of infection because you are more prone to risk of infection now since you don't have a spleen anymore monitoring your blood and filtering everything out. Next, I'd like to discuss the long-term effects of a splenectomy. So since you don't have a spleen anymore in your body, you are more likely to have an increased risk of, the first thing would be septicemia, so a bloodstream infection. Again, you don't have the spleen there monitoring and filtering out your blood anymore. You're also at an increased risk of blood clot in the lungs. And then you also have increased risks of coronary artery disease, cancer, as well as a higher risk of bacterial infection since you no longer have a spleen. Next, I'd like to discuss two main parasitic infections. The first one being malaria, which we've all heard of, and then the less common one would be, I don't know if I'm pronouncing this correctly, but Babesia. So these are two of the main parasitic infections an individual is susceptible to if they don't have a spleen. Without the spleen, the individual cannot filter out infected red blood cells as well. So individuals should take extra precaution to avoid these infections in visiting any of the regions listed below. So to start off, we have the Babesia parasitic infection. This is spread by tick bites in the northeastern and the upper Midwestern part of the USA. And this, if you look at the right side of the PowerPoint, the Babesia section is at the bottom. So all those regions on the map is where a person who doesn't have a spleen should avoid. Then we have the malaria parasitic infection, which is at the top picture of the map. This is spread by mosquito bites in Africa, Asia, and South and Central America. So basically, if an individual doesn't have a spleen, they should take extra precaution when visiting these type of areas and take the appropriate prophylaxis as well, or even try to avoid these areas overall. Next, this is the very common question is, can you live without a spleen? In short answer, yes, you definitely can live without a spleen because the liver can do many of the same things a spleen can as well. However, since you don't have a spleen, you do have a risk of developing infections quickly, certain infections quickly. So you have a higher risk of becoming sick and contracting serious infections. You also will have a harder time recovering after a serious illness or injury, as well as the highest risk of contracting infections is right after surgery if you don't have a spleen. The recommended vaccines after spleen removal are pneumonia, influenza, the Haemophilus influenza type B, and the meningococcal vaccine. It's definitely recommended since these individuals are considered a little bit more immunocompromised, that they stay up to date with their vaccines and get them as often as every 5 years for the meningococcal and the pneumonia one as well, and just stay up to date with all their vaccines because they are more prone to infection compared to another individual. Another thing, there's this pill and pocket thing that the individuals that don't have a spleen participate in. These are basically just antibiotics you just have in your pocket, just on hand in case you experience an infection. So if an individual experiences a fever, chills, abdominal pain, they'll go ahead and take these antibiotics that they just have on hand because they are more likely to experience an infection since they don't have a spleen. Next, I'd like to discuss the functions of the liver, because if you don't have a spleen, that's okay since the liver can do some of the similar functions. So I wanted to include that in here for completeness. So first, the liver filters the blood and breaks down poisonous substances just like the spleen does. It produces a fluid called bile that helps digest fats and gets rid of waste. It resists infections by removing bacteria from the bloodstream. And it produces the protein albumin that keeps the fluid in the bloodstream from leaking into the surrounding tissues. And I have a picture of the liver and the spleen. So as you can see, the liver is just right above the spleen in that photo. Next, I'd like to discuss the sickle cell anemia and the spleen. So one of the main conditions affecting the spleen is sickle cell anemia. So sickle cell anemia can cause the spleen to get bigger and blood counts to fall. Sickle cells inhibit the ability of blood to flow through the spleen by blocking the blood vessels leading out of the spleen. This phenomenon is called a spleen crisis in sickle cell patients, and this is a life-threatening emergency that needs to be treated immediately because it causes the spleen to get bigger and bigger. So I have a picture of if you have sickle cell anemia, this is a picture of what your spleen would look like within a spleen crisis. And symptoms of a spleen crisis in sickle cell anemia would include pale skin, fatigue, fever, irritability, as well as abdominal pain on the left side. There are also several other medical conditions that affect the spleen as well. Another one would be thalassemia. So in this condition, the spleen enlarges in order to produce more blood cells because individuals with thalassemia have bone marrow that have trouble producing red blood cells. So the spleen gets bigger and bigger to compensate for the bone marrow. Eventually, you'd have to get the spleen removed because it gets too big. The next condition is hereditary spherocytosis. In this condition, abnormally shaped red blood cells get trapped in the spleen, causing the spleen to enlarge. A splenectomy is typically the recommended treatment for this condition because the spleen gets way too big for the body. The two other viral infections are mono and malaria, as well as other viral infections as well. These specific ones, mono and malaria, are two of the most common ones for people who don't have a spleen. And for people who have a spleen, these viral infections cause the spleen to become enlarged, and eventually you would have to get it removed. And then the last medical condition I'd like to discuss is cancer. And in individuals with certain cancers and lymphomas, such as leukemia, the spleen can become enlarged and you have to remove it as well. Next, I'd like to discuss the spleen and its role in drug metabolism. So I mentioned this previously, but the splenic parenchyma is a site of drug metabolism within the spleen. And the splenic parenchyma helps metabolize drugs that are excluded from other sites due to their size or charge. And these drugs can include monoclonal antibodies, nanoparticles, as well as liposomes. The spleen only receives about 5% of the total cardiac output of the body, which means the spleen has very little impact on the management of overall drug distribution within the body. So basically, the spleen doesn't really have much of a role in drug metabolism as of right now, but further research is still being conducted. So it can be hypothesized that an individual can still have a normal drug distribution and metabolism without a spleen due to its very little function in drug metabolism. The spleen is now being considered a little bit more important, especially with its role in the absorption of new generation drugs, but further research is still being conducted on that topic. Lastly, I'd like to conclude with what drugs affect the spleen. As mentioned previously, the spleen does not really have much of a role in drug metabolism and distribution, but doing research, I found two drugs that do affect the spleen. So the first one would be cocaine. So if chronic cocaine use can cause rupture to the spleen by blocking the blood flow, and this will just cause the spleen to just rupture and just deteriorate over time. And then we have our chemo drugs, often used in chemotherapy. These drugs overall cause an enlargement of the spleen over time as well, leading to the splenomegaly. And then you would most likely would have to get your spleen removed in these type of situations due to the rupture or the enlargement. And that brings me to the end of my presentation, and I would be happy to take any questions at this time.
So does it, someone might have a question, but I have one for you, Alka, because you mentioned cocaine being metabolized through the spleen. Do you know if that applies to cocaine derivatives? Because there are drugs that are out there, they're almost all topical, that I'm aware of that use cocaine derivatives as numbing agents. And so do you know if it's just the cocaine specifically, or if it's any of the derivatives, I guess is my long-winded question.
So I don't know the answer to this question entirely, but just looking at some research, there is research currently being conducted on like heroin and other street drugs on the effects of the spleen, and it's hypothesized to cause rupture to the spleen as well. But there wasn't anything specifically stated about cocaine derivatives, unless you meant like the other drugs like heroin and stuff like that. But
no, I meant something like there's a numbing agent that's in development that's called ESO. I can't think of the chemical name of it, but it's just a topical numbing agent. That's what I was thinking of. However, looking at street drugs effect on the spleen is actually, I understand why they're looking at that, because damage to the spleen causes a whole other host of problems. So does anyone else have any questions for her, either verbally or in chat? Because I'll watch the chat if anybody does. I'm trying to give it time, Alka, in case someone is writing.
No questions, just thank you for really a very good explanation of what the spleen does. Because we hear people losing their spleen all the time, and some people, it has no effect on them, and other people become very worried about infections. And so thank you.
Well, unless there are more questions, and I'm trying to make sure I give time to make sure that no one has any in chat, and I see none. So I think, and Alka, by the way, I don't know the actual answer either to my question. I was just going, I didn't realize cocaine, and I wonder about some of those derivatives. So, all right, hearing no questions and seeing no more questions, I'm gonna stop it.